In this section, we're going to be talking about personality, and Module 40 is going to be talking about the psychodynamic theories of personality with a primary focus on Freud. This was really where I got interested in psychology. I took a personality course, and some of you might take that later on in your studies if you're majoring in forensic psychology. And I learned a lot about Freud's theories, and I found them incredibly fascinating. Well, I've gone on to become a behaviorist, which is almost the antithesis of someone who's psychodynamic. I did find that learning Freud's theories was really very enlightening for me, and really, made me think about how people behave in their personality and how it develops. In fact, I went to Vienna a few years ago, and we actually went to visit Freud's house. So, according to Freudian or psychodynamic views, Freud talks a lot about the unconscious part of the self. According to the humanistic view, which we'll talk about a little bit later, the person tries to self-actualize. So they try to kind of become more of who they can be. We can also look at traits, which we'll look at in Module 42, including the big 5 factors and dimensions, as well as social and cognitive influences on personality and self-esteem and self-serving bias. So these differences on the way that personality is examined help us look at what we have in common. So a lot of these talk about, basic drives, stages, categories, traits, and there's a lot of overlap, as you'll see in these 3 modules, among the different theorists and in a lot of these constructs. We'll also see the way in which we differ. So, people, while we do have these stages or paths according to some theorists, there's obviously individual variation among them. And there's also, within each trait, there's levels of it. Like certain people have more obsessive compulsive tendencies. I don't mean that like in the disorder kind of way, but some people are more type A and other people are less type A. And so within those traits we have, varying levels. So personality is defined as an individual's characteristic patterns of thoughts, feelings, and behaviors that persist over time and across situations. So it's really, in essence, who we are. And I like this little caricature here because it talks about the 7 dwarfs. You have Doc in the middle, who is agreeable and open, Dopey, who is naive, Sleepy, who is contentedly lethargic, Doc, oh no, that wasn't Doc, that's Smiley in the middle, sorry, that's Doc here at the bottom, right, it's conscientious, Grumpy is neurotically irritable, Dopey, maybe I'm getting them all confused now, and then there's Sneezy and Bashful. It's been a while since I've thought about my little dwarves. So, according to this psychodynamic or psychoanalytic theory, which is kind of based on Freudian theory, the theories of human personality focus on the inner forces that interact to make us who they are. So, in their view, behavior as well as human emotions and personality develop in a dynamic, which means that they interact and they can change, interplay between the conscious and unconscious processes. So, the unconscious, so what we can't access, and this is kind of a theoretical construct, it's not something that we can measure, is a lot of what psychodynamic theory and therapy actually tries to uncover. They kind of feel that a lot of our personality are these repressed unconscious thoughts, and then part of therapy is bringing these repressed thoughts, these unconscious thoughts, to the conscience. And our personality is largely influenced by the interplay between the conscious and unconscious, including the various motives and inner conflicts. So as things try to be repressed or made aware conscious, there are these conflicts and things. So Sigmund Freud, he was a psychiatrist he started in Vienna in 1856, and he died in London in 1939, started his career as a Vienna physician, and he decided to explore how mental and physical symptoms could be caused purely by psychological factors. You may have heard the case of Anna O. He had patients who he called were neurotic, had anxiety in today's terms, and as a consequence, they had physical manifestations of their symptoms. And so he became aware that many powerful mental processes operate in our unconscious without our awareness. So even today, things such as there's evidence that pain disorders, fibromyalgia, irritable bowel syndrome, that many of these disorders are actually psychological in nature and have physiological consequences. This insight grew into a theory of the structure of the human personality and development. So based on his observations of his patients, he then developed this theory of personality, and his name for the theory and his therapeutic technique was psychoanalysis. So one of the key things in psychoanalysis, as I told you, is getting the unconscious to the conscious mind. And so he used a technique such as free association. You've probably seen this depicted on TV, where the client's lying down on the couch and you kind of just ask them to speak whatever comes into their mind, and then the therapist kind of interprets what the patient is saying, and kind of speculates that some of these things are due to the unconscious. He also suggests meanings for slips of the tongue, and latent content of dreams. Freud did the dream analysis, and you've often probably heard of the Freudian slip. You know, when you want to say, "I'm going to text you," and then you say something like, "I'm going to sex you," or something like that. So you have the cartoon on the right. "Good morning, beheaded. Beloved." So clearly the king is thinking of beheading his wife. So the diagram here on the left is kind of somewhat of an iceberg depiction of how Freud viewed personality. On the surface is the ego, which is mostly conscious, and it's kind of what we see between it's kind of the way that we think of things and our mind is working. It's our conscious mind. And then we have our id, which is completely unconscious, and that's where we have our drives, our sexual urges, our desires to be violent, etc. And then the superego is our preconscious. So it's outside of our awareness, but it's accessible. So it's like kind of like our morality. So personality develops from our efforts of our ego, which is our rational self, to resolve tensions between the id, which is based on biological drives like sex, desire for food, etc., and the superego, which is like our morality or the society's rules and constraints. So according to Freud, the unconscious is a reservoir of thought, wishes, feelings, memories that are hidden far away because they feel unacceptable. So these are our desires to fornicate, our desires to engage in violent behavior, like all our kind of things that we can't necessarily, that are very distinct from who we actually are, but we do have a lot of these desires according to Freud. So we start life with a personality made up of the id, which is striving impulsively to meet the basic needs of living by the pleasure principle. So you'll often hear this tied with the id, is the pleasure principle. So that's, again, like you'll see amongst toddlers, putting things in their mouth and trying to touch their genitalia, so that they're doing whatever they can to pleasure themselves. As the toddler develops, the ego develops, and a self that has thoughts, judgments, memories, and follows what kind of is the reality principle. So that's what's going on in real life, but it's still focused on the id's needs. At around age 4 or 5, the child develops a superego, or what we call a conscience, which is internalized from parent, society, and following the ideals of morality and principle. And so the superego could be kind of considered to be our morality or our conscience. And so the id works as the executive of this three-part system to manage the bodily needs and wishes in a socially acceptable way. So we have urges for sex. The ego might say sex is something that's bad, or sorry, the superego might say sex is something that's bad. The ego might say, well, the id wants it, the superego doesn't want it. What can we do, and how can we find peace in this relationship? So Freud's theory of psychosexual change. This is somewhat controversial, and we've probably heard about this before. But the id is focused on the needs of the erogenous zones, which are the sensitive areas of the body. People feel shame about these needs and can get fixated on one stage, never resolving how to manage the needs. So you'll see here in this chart, they have the oral stage between 0 and 18 months, where we get pleasure from the mouth, kind of sucking, biting, chewing. Anybody that's ever seen a toddler knows that this is true. Then between 18 and 36 months, when we start doing the toilet training, that's where we have the anal phase, so the pleasures focus on bowels, bladder, elimination, coping with demand for control. It's also, you'll see, where the potty humor kind of starts to evolve. The phallic stage is between age 3 and 6, where the kid realizes that it's pleasurable to touch the genitals, and they're also coping with the incestuous feelings they're feeling towards their mother, and the hatred they're feeling towards their father, who they're seeing as competition. This is called the Oedipal complex. The latency phase is between age 6 to puberty, where there's a phase of dormant sexual feelings. There's a lot of just cognitive and emotional development going on in the stage. And then what Freud calls the genital phase takes place puberty and later on as the maturation of sexual interests. So according to Freud, people can get stuck at any of these phases. And you can see the cartoon. I heard that as soon as we become aware of our sexual impulses, whatever they are, we'll have to hide them. So Freud believed, as I mentioned earlier, that boys in the phallic stage seek general stimulation, and they begin to develop unconscious sexual desires for their mothers and hate their fathers as a rival, feeling guilt and fearing punishment by castration. He called this the Oedipal complex after a story from Greek mythology. And so in order for boys to resolve this conflict, instead of kind of seeing their father as an enemy, they end up identifying with their fathers and kind of mimicking them. So Freud also talked about what was called defense mechanisms, and this is our way of being able to cope with these underlying urges from the id. And so he talks about regression, reaction formation, projection, rationalization, displacement, denial. So regression is kind of starting to behave in a more childlike manner. Reaction formation is when you kind of, you're really upset about something and then you kind of go the opposite way and say you don't care. Projection is disguising one's own threatening impulses by attributing them to others. Like if you feel something, you're saying that other people feel that way. Rationalization is offering self-justification. Displacement is putting your feelings on something else that's not applicable. So you can see the example, a little girl kicks the family dog after a mother sends her to her room. And denial is refusing to believe or even perceive painful realities. So your loved one is having an affair and you deny the existence of it. So here we can guess the defense mechanism. A politician gives anti-gay speeches and turns out to have homosexual tendencies. Did you guess reaction formation? I've actually seen that. Someone with an anger problem accuses everyone else of being angry and threatening. Correct, it is projection. These two are sometimes confused with each other, and the common theme with all defense mechanisms is they seek the individual they prevent the individual from being consciously aware of unacceptable feelings, and so it's easier to deal with if they belong to somebody else. The difference is the first one compensates and the second one distracts from the actual feeling. So we have some what we call neo-Freudians. So these were disciples of Freud, people that studied with him and then kind of continued on psychodynamic theory. So these are Adler, Karen Horney, Jung, and they accepted Freud's theories about the importance of the unconscious in childhood relationships and the shaping personality. And, I think that any modern day therapist would accept the role of childhood experiences in the development of personality. They also accepted the id, ego, superego structure of the personality. They also accepted the role of defense mechanisms in reducing anxiety about uncomfortable ideas. But where they differed from Freud was in a few ways. For example, Adler and Horney believed that anxiety and personality are a function of social and not sexual tensions in childhood. So basically everything that Freud postulated was premised in kind of these sexual desires, and they felt that wasn't necessarily appropriate. And Jung believed in what we have, a collective unconscious, so which is kind of like biologically ingrained in us, which contains images from our species experience, and not just repressed memories and wishes. So Jung highlighted universal themes in the unconscious as a source of creativity and insight, and he found opportunities for personal growth by finding meanings in moments of coincidence. Adler focused on the fight against feelings of inferiority and as a theme at the core of personality, but he might have been projecting from his own experience, was what some of his critics have said. Karen Horney criticized Freud for his portrayal of women and their subordination to man, although you have to kind of keep in mind where the time in which Freud was living was very much a male-dominated society. Women didn't have much roles then. And she highlighted the need to feel secure in relationships. So all of these guys took Freud's theories and modified them slightly. So how do we assess unconscious? So Freud tried to get the unconscious seems to be projected into the conscious through free association and dream analysis. Another thing is also called projective tests, and these are structured systematic exposure to a standardized set of ambiguous prompts designed to reveal inner dynamics. Do any of you know what these are? Correct. They are the ink blot tests or the Rorschach tests. So what you do is these are a series of 10 cutout or 10 cards that have ink blots on them. So they put ink and they smush the paper and they, but these are very standardized and the same ones have been used. And so they have people interpret them and see what they mean or tell what they see in the drawing, and by telling what they see, then a therapist would interpret what that means. The more modern system of doing this, called the Exner system, is they have these as visual stimuli, and then they have scored how people, who have depression generally seem to see them. People who have schizophrenia, how they generally seem to see them in order to decide personality. One of the problems is that results don't link well to personality traits, and different raters get different results because it's very complicated to actually conduct a Rorschach. Since Freud came up with his ideas, and these were very revolutionary at the time, some of the research has actually updated some of his theories. So development appears to be a lifelong process, and it's not set in stone by childhood. Infant neural networks are not mature enough to create a lifelong impact of childhood trauma. So if kids were abused before the age of 3, they don't have sophisticated enough neural networks to really remember it, so it can't really be repressed. Peers have more influence on the development of personality, and parents have less than Freud initially speculated. Dreams as well as slips of the tongue may have many possible origins, and that they are less likely to reveal deep unconscious conflicts or wishes. We may ignore threatening information, but traumatic memories are usually intensely remembered and not repressed. And so, when we talk about hearing about, recovered memories, that probably isn't the case. We don't usually forget those kinds of things. And however, sexual abuse stories are more likely to be fact and less likely to be wish fulfillment. So Freud kind of said sometimes people would imagine these stories because they had unconscious wishes to be in a sexual relationship with somebody, but that really often is not the case. And gender and sexual identity seems to be more a function of genetics than the Oedipal conflict and relationship with parents. So what are some flaws in Freud's scientific method? Well, it's unfalsifiable, so there's no way to test it and there's no way to check if it's wrong. He had unrepresentative sampling. He was kind of working primarily with upper middle class women in Vienna. It's not representative sample. He had biased observation, so he based theories on his patients, which may give him incentive to see them as unwell before the treatment. And post facto explanations are the hindsight bias rather than predictions. So he wouldn't, he would look at the outcome and then make judgments about how the personality functioned before, which we know can be biased based on the hindsight bias. So we now view the unconscious as, that we talked about memory processing, perception, and priming, but it's not a place, for really these unconscious thoughts, the way Freud said. We do find things like schemas that guide our perceptions, and we do have the right hemisphere, which can make choices without the left hemisphere verbalizing them, as we saw in the split brain subjects. And we do have conditioned responses or learned skills and procedures that we can do without actual conscious recall, like riding a bike, for example. Our emotions can get activated, and we have stereotypes that influence our reactions. And priming can affect our choices. Remember, like when we saw the picture of bark, and we saw a picture of a dog or a picture of a tree, that influenced how we were going to define it. So that's priming. So what's Freud's legacy? Freud gave us ideas on the impact of childhood on adulthood, and human irrationality, sexuality, evil defenses, anxiety, and the tension between our biological selves and our social civilized selves. And so this is why, they say that when we get rid of kind of our culture, we would all be savages, because we have all these instinctual desires to fulfill our sexual, all our different needs, and it's only through our morality or our superego that we're prevented from doing so. Most colleges have courses related to psychoanalysis outside of the psychology department, which just basically shows you how widespread this is and how many people are interested in it. And Freud gave us specific concepts that we still, often use today, like dream interpretation, inferiority complex, oral fixation, sibling rivalry, and Freudian slips. Those are all things I'm sure that many of you have used in your everyday language. So it's, as it says here, not bad for somebody who was born over 100 years ago and had no technology, couldn't see into the brain. And so this was all based on his perceptions of his patients and his